name's Gary. I'm your student physical therapist. I'm just going to be taking some goniometric measurements of your knee, if that's okay.
Yep.
All right, so we'll start with measuring knee flexion. Patient is in supine. I'm going to be standing on the same side of the side that I'm measuring, and going to be palpating for the lateral epicondyle of the femur, which is where the fulcrum will go. The distal arm is going to be pointing towards the lateral malleolus at the head of the fibula and the midline of the fibula, and the stationary arm is going to be at the midline of the femur towards the greater trochanter. Go ahead and relax, and I'm going to move you into knee flexion. Okay. Ryan is at 125 degrees of knee flexion, which is below the normal of 150 degrees. Next, we'll measure knee extension. Patient is still in supine, but with this one, I'm going to be placing a towel below his ankle. Go ahead and scoot up a little bit. Okay. Once again, I'm standing on the testing side. The fulcrum is once again at the lateral epicondyle of the femur. Stationary arm is going to be towards the greater trochanter at midline of femur, and the moving or distal arm is going to be at lateral malleolus at midline of fibula. And go ahead, relax. And Ryan is at 1 degree of knee extension, which is above the normal of 0 degrees. All right, you're all set, Ryan. Yeah, I forgot. All right, Ryan, we're going to be doing some manual muscle testing of your hamstrings and your quads. Testing for weakness. We'll start by testing weakness at the semitendinosus and semimembranosus. Patient's going to be prone with their knee at 50 to 70 degrees of flexion. And for this one, I'm going to move him into internal rotation. I'm going to be stabilizing, standing on the same side. I'm stabilizing at the top of his leg, holding his thigh down. I'm going to push down at the ankle. Go ahead and resist. And that's a grade 5. Moving on to testing weakness of the biceps femoris. Patient's still going to be prone, and I'm still on the same side. I'm going to move the patient into 50 to 70 degrees of flexion at the knee again. And for this, I'm going to move him to external rotation. Once again, I'm going to put a hand and stabilize at the top of the leg, holding his thigh down, and one hand's going to be pushing down at the ankle. I'm going to push down, go ahead and resist. Good, grade 5. Can I have you sit up at the edge of the table for me? Now I'm going to be testing weakness of the quadriceps. Patient's going to be seated at the edge of the table. I'm seated on the same side. Go ahead and flex your knee slightly for me. I'm placing a hand under his distal thigh, and I'm also going to have a hand pushing down at his distal ankle. I'm going to push down, and I want you to go ahead and resist. Good, grade 5. All right, thank you, Ryan. Okay, Ryan, we're going to be doing special tests for the knee. We'll start with doing the anterior door test. You're going to go ahead and flex your knee, making sure that the hip is in 45 degrees and the knee is at 90 degrees of flexion. I'm going to go ahead and position myself as sitting on top of his foot, and my hand is going to be at the distal joint space, and my thumbs are going to be on the joint space. And I'm going to go ahead and pull the tibia anteriorly. Is there any pain with that? And there's no laxity, so there's no tear of the ACL. And for the posterior door test, once again, patient's going to be supine. I'm going to be seated on his foot, and my hands are going to be at the distal to the joint line, and my thumbs are going to be at the joint line. Once again, patient's in 90 degrees of knee flexion and 45 degrees of hip flexion, and I'm going to push the tibia posteriorly. Is there any pain with that? And there's no laxity, so patient does not have tear of the PCL or posterior cruciate ligament. Moving on to the McMurray's test. Patient's just going to be flexed at the knee and the hip. and I'm going to apply a valgus force while bringing the knee into extension. And for this, I'm listening for an audible pop, and there is none, so there's no tear of the medial meniscus. And I'm going to repeat the test by applying a Varistress while bringing the knee into extension. And once again, I'm listening for an audible pop, and didn't hear one, so there is no tear of the lateral meniscus. Finally, I'm going to be performing the valgus stress test, and I'll start with having the patient's leg supported, and he's going to be supine, and I'm going to apply a force at the lateral knee while pulling his leg away from midline. Any pain with that? And there's no laxity, so there's no tear of the medial collateral ligament. And I'll be doing the Varistress test. I'll once again support the patient's leg. I'll be seated on the table, patient is supine, and I'm going to pull the leg towards the midline while pushing and applying a force at the medial knee. Any pain with that? And there's no laxity, so there's no tear of the lateral collateral ligament.